Assalamu alaikum and welcome back to Medicower. In the hot seat today is Dr. Raj. We're talking about our kidney health. And just before the break, we were discussing not only what we need to do to keep them healthy, but also some of the things that stop us having healthy kidneys. So we've already, Dr. Raj talked about age and wear and tear, medications, smoking, and the importance of having fluids, particularly water, but fluids full stop. And the one thing that we didn't get to cover and discuss was about how kidney health links to diabetes. A big issue in our community.
It is a big issue in our communities, and diabetes generally is a really big issue, and it's a really complex issue because it's very multifaceted. What I mean by that is that it's lots of different aspects of lifestyles and even family life that we take for granted that actually are closely linked to the way and the behaviours we do that are linked to the way that diabetes can start and also it can progress, especially in our communities because of certain sedentary lifestyles, diets.
We don't have private chefs and private exercise
it
regimes.
builds up. It builds
we don't have
up.
those people to help us with those
It builds up. It builds up, and those things can affect your likelihood of developing diabetes, and secondarily to that, the effect that diabetes can have on certain organ systems that inside your body. We're talking about kidneys specifically here, but generally, the diabetes itself can affect multiple. I'm sure you know, can affect multiple organ systems on many different levels, from your eyes to the soles of your feet to your nerves. Kidneys is just one aspect of that, which is important to recognise. If you have diabetes, kidney checks are a regular occurrence, and you will get regular kidney checks. The reason why the kidneys are affected is something that most people sometimes don't understand. They don't understand how sugar is going to affect your kidneys. The reason why is there's lots of different reasons, but one of the main reasons that we keep a close eye on the kidneys is because sugar itself is kind of like a poison. And what it can actually do is it can cause aging and inflammation inside the lining of your blood vessels. Right. It changes the way your blood vessels form. I don't want to go into the exact science of it because it's quite technical, but over time it can change the way that your blood vessel walls are formulated and the flow through them as well.
Is that why people with diabetes take longer to heal and have sort of more complications with?
Exactly. So wound healing is a really important issue because you basically haven't got the blood going to that place. Right. You can only heal if you've got a blood supply. If you've got no blood supply going to a certain place, you won't heal. So people with diabetes unfortunately have lots of problems with their feet because if you think about it, the feet are so far away from the rest of your main part of your body. For the blood to get all the way down there and then all the way back up, it's quite far. And on the way, though, if those disease processes are occurring, you will reduce your blood supply to your feet over a long time, and hence why diabetic foot problems are so common. And in the same process, there are many, many tiny kind of microscopic vessels inside the kidney, and they are really sensitive and they're prone to the same kind of damage that the sugar does. And over time, those damage to the blood vessels can actually reduce the amount the kidneys actually work. And that can affect your kidney function because you're not getting, they can become scarred and they can become narrowed, and over time you're just not going to get the same effect from your kidneys, and it's not going to be able to act as good filter as it could have done.
Okay, so this is no different to any other organ really, where the blood supply going to those organs is going to be damaged. The kidneys are the same.
Exactly.
They can be damaged because of diabetes.
But this is so the diabetes in this level, we're talking about the small vessels. So it can affect multiple different sizes of vessels. You've got kind of big vessels in your body that are like hose pipes. You've got one called your aorta, which is a big hose pipe, and then that's your big blood vessel that supplies everywhere else. And then from there, it's like a branch. It's like a tree. So the branches get smaller and smaller and smaller, but unfortunately diabetes affects the little twiglets on the end where the tiny vessels are, and it can affect those quite dramatically. So if you've got it for a long time, more importantly, I might just want to add on one thing actually, it's not that you have diabetes that will cause those problems, it's the diabetic control that's more important.
Yes.
So if you've got diabetes and it's controlled, then you are in a better position than if you've got diabetes and it's not controlled.
Okay.
Sugar control is the most important thing. If your sugar goes haywire all over the place, then you are putting yourself more risk, because the high levels of sugar that are uncontrolled are going to cause those long-term damages.
So if somebody's had poor control of their sugar levels as a diabetic, they've created some damage for their kidneys and perhaps other organs, and then they change their lifestyle or their habits so they get better control of their sugar levels and they're not increasing them and being erratic with them, could those major organs get better?
There is a lot of evidence to say that there is, obviously the body is trying to heal itself all the time, but unfortunately the way that the body heals is the way that, I said it in our previous show as well, is if you cut yourself, you formulate a scar. Yeah. And unfortunately the same kind of process happens on the inside. If you keep damaging something, it will eventually lose its ability to stop healing, and it will start scarring. It can't regenerate. Yeah. So there will be scarring. It might not be visible kind of scarring that we can see, it might be microscopic scarring through kind of a lifetime of small little hits. Sure. So the answer is no. Over a lifetime, you can improve your kidney function. It can happen, but if the process is started and it gets getting insults, it doesn't make it. Going down that line of trying to improve yourself later on, sometimes it's just too little, too late. Yeah, okay. So it's better to try and prevent those things from happening in the first place than getting stuck with really bad kidney failure afterwards, because you can't bring back a kidney.
No, it's a good message. It's an important message for us to hear. It's not always one we like to hear, but it's one we need to hear. Okay, thank you for sharing that with us. I'd like to move us forward with the topic of the kidneys in relation to, you're a surgeon, you work in Leeds, and how often are you operating on people with kidney problems, and what kind of problems are you operating for? So
kidney problems are really, really common, and kidney problems are quite common in our communities as well. The reasons why someone would need an operation for a kidney problem is a quite complex question, and the answer is normally not that frequently. Okay. There are operations we need to do, but a lot of the stuff can be managed conservatively, which means we don't need an operation. Good. We might need to just change things in their diet, we might need to give them medications, and sometimes that is suffice, that is enough. Occasionally those things aren't enough, and sometimes if we think the kidney is at risk or there's something that needs to happen in order to make the kidney safer, then we need to do an operation. So what about kidney stones? What do they, is that like when you described the gallbladder in our previous show? Yeah. Do they originate in the same way? Yeah, so kidney stones are slightly different to gallstones. So gallstones are formulated in the liver and go into and they're formulated inside the gallbladder, specifically. Part of the biliary system, the bile system. That's right. Kidney stones are formulated in the kidney, and people sometimes get mixed up between the two. So it's quite important to think that they're completely separate. Okay. And you can, if you're very unlucky, you can have both. Very, very unlucky, you can have both. Kidney stones tend to formulate because there's normally some kind of imbalance in the salts that the kidney is draining out. Right. Whether that's any one particular salt up or down, it's really complex. It's a massive cocktail. Your urine that we produce is a massive cocktail of different chemicals. There are certain things in your diets that you can control to reduce your risk of getting kidney stones, but normally we don't tend to advocate kind of really specific diets for that problem unless you've actually got a kidney stone. Some people, unfortunately, are just more prone to getting kidney stones than other people. And what it basically means is over time, when the salts in your urine actually become a bit more solid, they can end up forming little balls, little pebbles, and over time they grow. And as the salts in your urine flow over these little stones, they actually end up making them bigger. Though stones can be in one place, held in one place in the kidney, they can stay there for your lifetime. And unfortunately, where the problems sometimes come in is where the stones can move. So the stones can actually go out of the kidney and into the main kind of drainage system of the kidney, where they can cause all the problems and cause all the pain. Okay.
So is that more not just stones that would cause pain, but I was thinking in terms of people get infections as well with kidneys, don't they?
Yeah.
What's the reason behind that?
Infections are slightly different. Okay. So infections work the other way. So normally it's an infection down below. Okay. And it actually works its way up into your kidney system. Right. The distance is quite long. Yeah. Normally people get like a urine infection. They can get a bit of pain or a bit of stinging when they're passing urine, and that's quite common. And we see that a lot, and we can treat it. And it's a really common condition we can treat in a GP surgery, and you never need to come to hospital. So is that a lot to do with hygiene issues? Sometimes it's not. Actually, it's. There's some data say, obviously, you know, if you are having any problems with your hygiene, it can, I suppose, increase your risk, but it's unlikely. It's unlikely. Okay. What's more common is probably actually people have, especially in males, you can have actually differences in anatomy. So it's not a normal drainage system that can mean that. The best way you can describe this, the best analogy I can give, is if you are kind of near a body of water, like a river, and you're parched and you're really, really thirsty, and you're in the mountains somewhere, you can drink from water from a river, because river water is flowing, and it's because it's flowing, there's a continuous flow, and there's no infection. There's no infection risk. You can drink from river. You can't drink from a lake because the water is stagnant and it's sat there. There's built up in stuff, and there will be stuff in there that's going to be toxic to you, poisonous to you. The same process is happening inside your body. Any part of your body where a fluid that should be moving around that is not moving around, it will become infected, full stop. Sure, that makes a lot of sense. And that's the same with your urine. So urine is made in the kidneys. There's two kidneys. They drain the urine down into a collecting system, in a drainage system, and then it collects in your bladder, and then you pee it out from there. If at any stage in that process there is a blockage or there's some stopping, then you will end up with an infection. So that's quite common at the bottom end, and sometimes, unfortunately, those infections can spread up and into the kidneys themselves. It's rare. Sometimes it only happens on one side and not the other. Some people are more prone to it than other people, but unfortunately it's part and parcel. No, I think that's really helpful and really clear to understand that, because I think a lot of people, you know, they're good at their hygiene when they're using the bathroom and things, and they're still getting infections. It's a good thing to understand. For those kind of people, I mean, the key is to keep the river flowing, and by that what I mean is, if you keep yourself hydrated and you give yourself lots of water to drink, you're basically pushing in that waterfall and forcing the stuff down rather than trying to make it go up. So in that way, I think that's the best analogy I can give, really. Really, and by doing that, you can actually flush the water out and all the bugs and all the bacteria that are causing those things, are germs, and stop them trying to work their way up into the main system. So another reason why we need to keep drinking water. Another reason we need to keep drinking water. And as we've both demonstrated that very nicely today, aren't we? Yeah. Okay. Just because I need to keep on top of the time we've got left, what signs and symptoms might we get that mean we should get checked for kidney-related problems? So kidneys, unfortunately, kidney stones, you'd get pain. That's the most common feature, is people get pain, they feel sick, they feel a bit nauseous, they can vomit. Where are they getting the pain? In the back? In the back, yeah. So they get pain in the back, in the side. The typical pain actually that we get with kidney stones that all the doctors will be looking for when you talk to them about kind of this kind of pain is what we call loin to groin pain, which what we mean by that is this is your loin over here and your groin is obviously down there, and actually people get these kind of jolting pains where it travels, the pain travels, and they feel it going from their loin, from up there, down their body, into their groin. They feel this movement, and the pain can be cyclical and come in waves, and that's the typical pain of kidney stones. For men and women? For men and women. Unfortunately, another sign of infection and of kidney stones is if you get blood in your urine. So if you notice that your urine is slightly changed colour, it looks like there's a pink tinge in there, or if it's just frank red and it's bloody, you need to see a doctor. And you've got to make sure you've not been eating a lot of beetroot at the same time, I guess. Agreed, yeah. I mean, probably that does change the colour of your urine. Some things do change the colour of your urine, but obviously, you know, if you're getting any other symptoms as well and you're concerned, then firstly cut back on the rhubarb, but then maybe try beetroot. maybe see a doctor.
Okay, so pain's one of the
pain,
key
one
things,
of the things,
that sort of journey of pain is relevant.
Yeah, okay. But I mean, other things can happen. With kidney function deteriorating over time, long-term kidney problems, people can just feel really lethargic and feel tired, feel like they don't have the energy to do stuff, and it's really vague. Like, you know, if someone ever told you that, you'd be like, okay, well, yeah, okay.
Well, iron deficiency can be like that, can't
exactly.
it? And
there's so many conditions that can present in the same way. So with these kind of like vague, kind of vague symptoms that people can present to their GPs with, we have to be responsible and do the appropriate tests to make sure that we rule out the common things. And unfortunately, kidney problems are quite common. So we have to make sure we get rid, make sure that's definitely ruled out. And a blood test is the easiest way to help with that.
I was interested to find out a little bit more about why people have kidney transplants and what that entails, really.
So like we've said about long-term kidney problems, over a lifetime, if you get repeated insults, I say that sometimes there is, if someone is very, very sick and they have a single insult to a, like
what do you mean by insults?
Like a hit, like some kind of damage that's happened very suddenly, then actually it might happen a lot more quicker. The kidney failure might happen a lot more quicker. Long-term kidney failure will normally track and progress over time, and you get like kind of bits where it goes really bad and then it improves a bit, but then it gets worse again, and then overall the general pattern is there's a downward trend in the function of the kidney. When your kidney function is really, really poor, then we have to start thinking about what we can do to improve that function for you. At the moment, the way the technologies that we have are, one of the most amazing things that's come out of modern technology is the fact that we've got something called hemodialysis, which is basically a system where we can hook you up to a machine. The machine takes your blood out of your body, goes through a processing unit, cycles it through, gets rid of all the gunk, all of the bad stuff, all the poisons, and then that same blood is traversed back through different tubing and goes into another vessel inside your body.
This is the kidney dialysis.
This is kidney dialysis. This is dialysis that we're talking about, and the dialysis is really important because it basically gives people the chance to live a normal life again, because it means that their kidneys, if you left your kidney by itself as a failing kidney that didn't do its work, unfortunately you would die. So these people are dependent on dialysis. And some people are dialysis dependent, which means they go like once every 2 days, once every 3 days.
Is that how often they have to have it?
Sometimes, yeah. And once every 2 days is quite common for those kind of people. Can go have a less of a time gap between them. That's completely normal. But with the very, very severe cases, you can be that you're going once every 2 days, hooked up to a machine for several hours to try and get that blood churned out. And those blood, that machine is doing exactly what your kidneys are doing, except for right now the machine is massive, but the way that your body is engineered, the whole thing can be done in something this big, which is quite remarkable. But we haven't got to that technology yet. We've got massive machines still doing all of our work for us that our kidneys are doing on this kind of scale, and a lot more effectively.
So what are the main reasons people end up on dialysis then?
Long-term kidney kind of failure, we call it chronic kidney disease, which basically means long-term problems with the kidneys that aren't really getting very much better. There's normally little bits of peaks and troughs where it gets a bit better and gets a bit worse, but overall the trend is that it's getting worse, to that point where you can't sustain yourself on that kidney function anymore, and you are then hence bound to having some extra help, which means going to a dialysis unit.
Do you see people of a certain age range that are more dependent on dialysis, or is this that could be at any age?
I mean, there are cases where you can get younger people on it, but they're rarer. The most common ones are in the elder generations.
Is that because of the wear and tear element?
Wear and tear element, repeated hits to the kidney over time, and there are occasionally things that as doctors we can do which can reduce your kidney function. It's a decision we need to make really, really delicately, and we would involve the patient obviously every step of the way with that decision, but sometimes in certain cases like certain cancers, certain chemotherapy type regimes that we have to start, there is unfortunately a side effect of having a reduced kidney function, which of course we have to take the risk and benefit into account, and then we can make a joint decision with the patient about what we think is in their best interest and whether they're happy to go ahead with that or not. and sometimes those things mean that people do end up on dialysis units, but that's rare. The most common reasons why it happens, common things are common, and unfortunately kidney disease is common, but more common in the elderly generations. But starting younger and trying to stop those things from happening in the first place is the best way to stop yourself ending up at that end point.
I know somebody who's surviving very well on one kidney, but I think from a hereditary perspective, she's had a non or a very small kidney compared to a normal sized kidney.
Yeah.
And I know in her youth she was told the risk factors, she was encouraged not to have children because of it. What kind of advice are we giving today to people who have got kidney problems and who want to have children?
I think it's really complex because it's all on a case-by-case basis. I've said at the beginning of the show you can function on one kidney. That's completely normal, that's fine, that's true. Occasionally people can have problems with their kidneys, which means that if you put yourself through a different bodily, not a normal bodily process, and you put yourself at a strain, then you have to put your kidneys through that same strain as well, because they have to work doubly hard. And pregnancy, unfortunately, is one of those strains. It's a normal thing. People get pregnant, but it's in terms of what's happening inside your body, it's a massive change. You know, the amount of blood that you've got is increasing, you know, by a certain factor. You've put all of your organs under strain, your back's under pressure, your heart's having to work harder than normally hearts have to work, you know.
So this explains why doctors say it's that the risk factors are increased.
There's a massive
Because I know this friend of mine, she went on to have 2 more children.
Yeah.
But I also know how much monitoring she had to go through. Of
course. And,
you know, alhamdulillah, she came through with healthy, you know, children that have grown up now.
Yeah.
But yeah, I think it was a question I wanted to throw in before we came to the end.
Of course, I don't want to say that you can't have children. That's not.
No.
That's not what I'm saying. What needs to be done is if you're in that certain situation where you've got a very rare condition, where you've only got one kidney or anything like that, you need to just have a discussion with your nephrologist, which are the kidney doctors, and you need to come to a joint decision as to what you think could be best and what you think you can handle.
That's really helpful.
In terms of, you said transplant, just really quickly.
We've literally got 1 minute left, yes.
I think transplant is the last resort.
Yes, I can see
People
that.
wait on the transplant register for many years. Unfortunately, as someone from an Asian background, you're 3 times more likely to need an organ transplant compared to the Caucasian population. But in terms of actual percentages, we only formulate 5% of the organ donor register. Yeah,
it's like blood donations. We're not very good at getting involved with donating blood as a community, because I used to work in areas of sickle cell and thalassemia. And we absolutely need people from the same ethnic communities to help those families who need, those individuals who need those transplants and those blood donations. I think this is a topic we could go on and talk about for a long time still, and hopefully we'll get a chance to revisit it.
Thank you very much.
What was your top tip for today before we bring things
to an end?
Top
tip is stop drinking rubbish energy drinks and just stick to water.
Brilliant.
Stay hydrated and keep your kidneys the best chance they've got.
Lovely. Thank you so much.
It's
okay, everybody. Unfortunately, that means that we've come to the end of the show. There is so much more that we could discuss. Inshallah, we'll revisit these subjects as time allows us in the future. I hope you found it useful. Please keep me in your du'as. Assalamu alaikum wa rahmatullahi wa barakatuh.